Hello again, folks. This is Dr. Mike, and we're back now with our Medical Exercise 101 ebook training series, or video series, I should say. And now we're going to look at topic number 14. Now, our last topic looked at something related. What are the liabilities associated with providing medical exercise training services? Now we're going to look at what medical clearance means, or the phrase medical clearance. And I think these two kind of go hand in hand. Number 14, what does medical clearance mean? This is a very important concept. This means the physician, physical therapist, or chiropractor has given the clearance saying the client is medically stable and appropriate to begin an exercise program. The medical clearance should come from the client's physician, but a clearance from a physical therapist can also suffice. Now remember, a chiropractor is considered a physician, so they obviously meet the role or meet that requirement of a physician with providing a medical clearance. Not all physicians understand exercise and the associated ins and outs and do's and don'ts, and the stress the exercise places on the client's damaged tissues. So even though the physician is given medical clearance, you still must screen the client and ensure of their appropriateness for exercise. So folks, that's your professional responsibility. Just because the doctor says, hey, you still have to take the professional responsibility and screen and perform a medical history on the client to make sure they are appropriate. If you're the medical exercise professional, you're the last line of defense to ensure the client is appropriate for an exercise program. You will have clients with medical clearances but exhibit red flags. These clients must be referred back to their referral source. So an example of a conversation that you could have with the client's physician sounds like this. Dr. Smith, the patient you refer to us, Mr. Johnson, is exhibiting red flags that indicate he may not be appropriate for exercise. We can make some modifications to his exercise program to ensure the program is safe and effective, or we can refer him back to you for your evaluation. This now allows the physician to determine the best course of action, but you may have given up the option of making exercise program modifications. As a medical exercise training professional, MET professional, one of your roles is to recommend exercise modifications to medical professionals. In many instances, they may not know the ins and outs, as we said, and do's and don'ts of exercise. You make the recommendations, and if the medical professional feels those recommendations are appropriate, or if he or she feels what you've described to them as red flags are significant, they may still be declined in, or they may go along with your recommendations. We're going to leave that up to them, but make sure you document it. Lastly, make sure you understand exercise tolerance. Even if the client is medically stable, their exercise tolerance may be low initially. That doesn't disqualify them from participating in the exercise program, but you will need to manage their exercise sessions appropriately to help them build their tolerance. So folks, there's an old saying that I learned when I started working in rehab centers, and the old saying is, it's not where the client starts, it's where they finish. Okay, so don't try to get them to the 1 mile mark on day one. Just start with a few steps and gradually build them up. The great thing about exercise is it works if we give it time and if we continue to do it. No one in the history of mankind has died from acute lack of exercise. They died from chronic lack of exercise. So we don't have to get them to the point they're an Olympic athlete in a couple of days. Let's work with them and give them time for the connective tissue structures, the cardiovascular system to improve, the pulmonary system to improve. It takes time, and that's what you guys do very well. You know how to develop the exercise program. You know how to progress the client. Let's always remember that along the way, and always make sure we do have a medical clearance along with doing your screening and making sure the client is appropriate for exercise. So please come back and join us for comment number 15 or tip number 15. We're going to talk about what happens when the client has significant pain in a training session. We'll see you then.